Welcome to Black Feathers, a true and honest conversation about disabilities for all. I am your host, Dr. Crystal Hernandez from the Cherokee Nation. The Cherokee Nation is a sovereign tribal government. Upon settling in Indian Territory, present-day Oklahoma, after the Indian Removal Act, the Cherokee people established a new government in what is now the city of Tahlequah, Oklahoma. A constitution was adopted on September 6, 1839, 68 years prior to Oklahoma's statehood. Today, the Cherokee Nation is the largest tribe in the United States with more than 450,000 tribal citizens worldwide. More than 141,000 Cherokee Nation citizens reside within the tribe's reservation boundaries in northeastern Oklahoma. Services provided include health and human services, education, employment, housing, economic and infrastructure development, environmental protections, and more. With approximately 11,000 employees, Cherokee Nation and its subsidiaries are one of the largest employers in northeastern Oklahoma. The tribe had a more than $2.16 billion economic impact on the Oklahoma economy in fiscal year 2018, and we all know that has continued to grow over and over every year. The Cherokee Nation is committed to protecting our inherent sovereignty, preserving and promoting Cherokee culture, language, and values, and improving the quality of life for the next 7 generations of Cherokee Nation citizens. Hello and welcome to Black Feathers Podcast, Episode 4 of Season 2. Today we are honored to have Dr. Amber Tiehen from the Cherokee Nation. Amber, could you please introduce yourself to our listeners and share some insights about your background and your role within the Cherokee Nation?
Hi, so happy to be here. My name is Amber Tiehen. I am the Senior Director of Rehabilitation Services for Cherokee Nation. I'm also a physical therapist. I have been working for Cherokee Nation for 10 years now, and just very appreciate the time to talk with you all today.
How did you get into this work?
So becoming a physical therapist, that was a decision that was deeply rooted in my passion for helping others, making tangible differences in their lives. Growing up, I'm from Adair County. I'm a Cherokee citizen, and so I always wanted to give back to my community because that was a way for me to show my gratitude for the support and the care and the opportunities that I received over the years. My community shaped who I am, and I feel that deep responsibility to contribute in whatever way that I can. And so whether that's offering a helping hand to someone or using my skills to make a difference, giving back has always been important to me. And so I became a physical therapist because I believe in the power of the movement, profound impact it can have on someone's life. It's about more than just the physical healing. It's about restoring hope, confidence, and the ability to live life daily. So I love serving patients. I love caring for them. I love developing relationship with patients and their families, and just helping them get whatever they need and healing in whatever ways that may be to them.
That's beautiful. You know, a lot of times helping professionals get into this for those similar reasons. They want to give someone that spark, that quality of life, that healing, that opportunity. And so thank you for sharing your why with me. You and I have been serving together on the Cherokee Nation Autism Task Force, and so I've gotten to know a number of the initiatives that you've done as well as some of the program services, but I too am excited to learn more about everything that goes on in your department because our nation is so incredibly big in terms of its service structure. So I am going to be listening as well as chatting with you. Can't wait. All right. So can you tell us just a little bit more about the specifics of your department in terms of services, people served, anything that you think is relevant to really let the listeners understand the gravity and reach of what you do?
Yes, of course. So the Rehab Services Department includes physical therapy, occupational therapy, and speech therapy. We evaluate patients of all ages to address any physical, functional, or communication needs. Our group of therapists are specifically trained to provide therapy services to individuals with autism, and we like to take a collaborative care approach. So we work really well together as a team to set goals, and we assist both the patients and their families to help them achieve their goals. We like to partner closely with pediatrics and primary care to make necessary referrals for any patient care needs or testing accommodations that are needed. We collaborate with Pervasive Parenting to offer a monthly support group for caregivers. This group, we also have a Zoom option for those caregivers that are outside of Tahlequah, and that allows them to participate and connect with others and learn about just available supports for their child with a disability. It's a really fun group. Our therapists also work with Pervasive Parenting to host a monthly adolescent social group, and this is aimed at young adults ages 14 and up. This group focuses on developing and helping individuals improve their social, their job, and their self-advocacy skills. And these groups are held on the last Tuesday of each month at the Cherokee Nation Outpatient Health Center.
That's a wide array of services. Can you share with our listeners just a little bit more about the specifics of physical therapy and kind of what it is that happens in that type of modality?
Yes, so physical therapy, for our autism population, we focus a lot on gross motor development. So working on walking, balance, participating in school, being able, to play with their classmates, be involved in the community. We work a lot along those gross motor movements. And we do a lot of co-treatments with our occupational therapists and our speech therapists. So it's really awesome because a lot of the times our PTs and our OTs and speech paths, we work together during the session so we can work on multiple things at once. So while we're working on jumping and balance, our OTs can be working on sensory integration. Our speech paths can be working on communications or device use. So that's really what our therapy sessions are. We make them a lot of fun. Therapy is more beneficial if it's through play with children. So we try to have a lot of fun. We play games, and we try to make the sessions as beneficial and goal-oriented for whatever the family feels like is needed.
Integration of services is so incredibly important, and I love the fact that you not only see the function of it, but you really seem like that's something you strive for. So it's beautiful to hear that. The other question I had just around the treatments and services, you mentioned support groups for caregivers. Have you seen a vast demand for those caregivers needing that type of connection with others like them?
Yes, definitely. We started over a year ago, and the support group has slowly grown with time. But we have some really consistent families, and the feedback that I'm getting from them it's just astounding to have a place to go to talk with other parents and other families about the good days and the bad days, to find resources, things to do, places to go, and they sometimes will plan play groups between the families, and so that's been a lot of fun. And then just them forming the relationships and just having a place to go for support has been a huge benefit. As
a caregiver myself, with my youngest child being autistic, it's definitely one of those things when I talk to other caregivers. And here's the thing, the beauty of it. It doesn't have to be a biological parent. It could be aunts, uncles, grandmas, grandparents, godparents, whatever that combination of caregiving looks like. I love the fact that there's places like the support groups, whether it's in person or via Zoom, that we can come together and, like you said, share those moments, that experience, that be that sounding board, but also to never feel that you're alone in that journey or in that transition, because we learn from one another every single day, but we also feel that we're unique sometimes or that we're on an island sometimes. But, having those opportunities to share and to gather is incredibly powerful medicine, because it does something for your soul and for your spirit that a lot of, traditional things don't do, because we have to really value the, experiences and the thoughts and the emotions that come with caregiving. So I'm so excited that we offer those services at the Cherokee Nation. So in the grand scheme of things, as I mentioned, we were on the Autism Task Force. We're on the Autism Task Force together. And I know that we had, community engagement meetings and a number of other things while we were drafting this comprehensive plan that we will link to this episode. Can you kind of share some insights that you kind of gleaned or just your insights about the experience of drafting this and serving on such a monumental initiative?
Yes, definitely. It was such a great experience to meet with other healthcare providers, to meet with you, so many knowledgeable people in this field, and then to meet with families. It was just such a great experience learning more and getting together to find out what exactly the needs are, where we're at, and kind of where we need to go. The Autism Task Force, we held 2 town hall meetings, and those were incredibly valuable, just in opening up the dialogue with the community. The discussion centered on various key themes, including caregiver support, wait times for testing, and accessing resources. We also talked about creating inclusive care environments, enhancing access to behavioral therapy, and workforce development for autistic individuals. And the feedback that we got from the town halls was crucial in shaping the efforts to improve the autism diagnosis and the treatment within the system. And so Cherokee Nation is going to continue working towards everything that we identified in our report. And so I'm just really thankful I got to be involved, and it was such a learning experience for me. And it was kind of a springboard on what we need to do to make everything move forward and identify those needs.
I could not agree more. Being a citizen and also having a child with unique needs and being a mental health professional, a behavioral health professional, it was such a beauty. And I think I've shared that a number of times, not only how proud I was of our chief for taking that step forward and saying, we're going to build on everything that came before us, and everything every year grows and grows. And so, when I first got, involved in this world, asking for proclamations. And then from that proclamation, seeing every single year, not only would we do that as a nation, but we also built on that, saying, okay, now we're going to enhance the way that we, do our service structure for individuals with unique needs. Now we're going to make sure we're screening everyone, make sure we're training people, look at, how we can involve other disciplines and other departments in serving not only the individuals, but the families. And that includes the lifespan. And I thought that was so beautiful that, as the task force, we looked at the youth, of course, but we looked also at the grown adults and those that are transitioning from youth to adulthood that are, autistic and that do have, co-occurring conditions and life challenges, but also beautiful strengths. And I thought that was an amazing way that we framed the way that we structured that, output, saying, here's the lifespan, here's some of the challenges, yes, but here's also the great opportunities. What did you think about kind of the lifespan inclusion?
Yes, definitely. Like I said earlier, a really just great learning experience for me. And as we got into the needs with families and where they were at, college resources, housing, job opportunities, just how we can open doors for these individuals and help them to lead these productive, independent, happy, healthy lives. I think it's going to be really great for our community.
I do too. And some of the services that you talked about within your respective department, those are really critical services for being able to do, certain tasks that people take for granted. You said, tie shoes, use, hand-eye coordination activities, things like that. It's balance. There's just some very critical things that you do that really do improve the quality of life for the individual, their family, and the longevity of their life as well. And I thought it was captured beautifully in the final product of the task force report, which gave those recommendations. Do you want to talk a little bit about that process of when we delivered that recommendation document to leadership and kind of what happened after that?
Yes. So we completed our project and we were able to submit everything to the chief for his review. We've got great feedback from families, great feedback from healthcare professionals about things that we identified. And since then, we've just been working towards checking those things off of our list, working towards enhancing services. One of our focuses is early detection and evaluation, because we know how important that is to provide that foundation for better long-term outcomes. The earlier a child is identified, the more we can maximize their brain development. And early interventions, they take advantage of the brain's plasticity. And so that's the ability to adapt and to change. And it makes it easier to address challenges. And so through early interventions like speech, we can do social skills training. Behavioral therapy can help children develop those vital social and communication skills more effectively. So those are ways we're trying to identify how we can improve our services. And so with that early intervention, we can make referrals to primary care or pediatrics. We can do additional testing. We can identify service needs. And if we get started earlier, this can improve that child's quality of life and help them function more independently and succeed academically. We like for them to be successful in their community and have a great social life. And so the early investment, it really gives children with autism the best chance to reach their full potential and thrive. And so after we submitted that to the chief, it's just, it's been full of support on where do we go next and what we need to do. And each department at Cherokee Nation is doing their part and working on what to do next.
I'm glad you said each department doing their piece, because when you look at the final product, it really did touch on so many other departments coming together and kind of creating this tapestry of service for individuals and their families, regardless of, where they lived, their age, and what that combination and composition of family looked like. And so it does take a lot of effort, initiative, creativity, innovation, and vulnerability in some cases to kind of look at what does my department do currently. And when we were going through kind of that whole system mapping of what currently exists, what's the present state, and where are the opportunities, it really did allow us to say, all right, what is each department doing? And then that alone was a learning initiative, because sometimes we get so stuck in, what it is we have on our plate that we forget to look around. Or if we look around, we didn't really take it in, and say, oh gosh, they're doing some really amazing stuff over here. How can that work with my thing? And so I do love the fact that we said, okay, we're building this comprehensive lifespan, all-encompassing kind of plan. And how can each of the departments look at the pieces that are theirs and figure out how to lift this thing? And so I also love the fact that you said it's a work in progress. And I think we all know it's a work in progress because it is incredibly large. And I think that's one of the things that I really took away from Chief when he was talking about this plan last year during our Autism Awareness and Acceptance Month. In his speech, he was talking about the fact that we are all learning and we're continuing to evolve as we go. And something changes and grows and we learn something every day. But the fact is we keep going forward. We want people, who realize that they're part of our system and that they want to be seen. And so one of the quotes that I took from his article, it says, still, no matter what challenges and potentials our fellow community members bring, everyone deserves to feel seen, valued, understood, and accepted. As we take this journey together, let's remember to listen, learn, and celebrate the beauty of our differences. And that, I think, summed up kind of the entire effort of what we were doing, because it was all about the system, but more so about the people and how the system can help serve the people and allow them to be seen. And like you said, have their full potential realized. So fabulous. Is there anything else that I didn't ask you about the Autism Task Force or plan?
I think, let me see, Crystal. We might
I know, it's so
that.
big. It's so big. We talked about the early identification, the screening that takes place, capturing that data in the electronic medical record was a big deal. We also realized that, like you just said earlier, there was a gap in terms of access to diagnostic evaluations. No matter what the age was, there was just a wait list most places, and some places it was incredibly long. And so having that be a piece of it, because it's kind of like, those of us that walk this journey, it's the key to get in the door, because you can't access a lot of the services without a formal diagnosis. Is that true, or is that different for the services in your department? Do you need a formal diagnosis, or is that something that you just kind of work on when you realize there's a medical necessity?
So we can work with patients. They do need a referral to therapy, but they do not have to have that formal diagnosis. So a lot of times we will work with kiddos that are having sensory difficulties or attention difficulties, difficulties with their activities of daily living, like you mentioned, tying shoes or putting clothes on. We can start early with them through therapy, working on those things without that formal diagnosis. And a lot of times we will help them communicate with their pediatricians, communicate with behavioral health, and we can help push forward those efforts where we see it is needed. And so we can begin working early, but even before they get their diagnosis. I would say one of the really great trends that stands out this year is how crucial it was to get the entire team involved as soon as any concerns arise. So if a parent is noticing something when their child is 2 or 3, that pediatrician that can cue them, okay, let's get you into speech therapy, let's get you into physical therapy, let's get you into occupational therapy to start working on those things. And the pediatrician can do their screenings, and if it's a positive screening that the child may have autism, then they can start the referrals to behavioral health. So while rehab services is working on this side, behavioral health can start working on that side. I know there is a wait for testing, but as soon as we get the test results and get those diagnoses, a proactive approach, it really just helps ensure that we are identifying and addressing those potential issues before the child even enters school. Another really awesome thing right now that was implemented is that behavioral health has a team member that is located in pediatrics. So as soon as a pediatrician sees that need or does that screener, a behavioral health staff member is there and can see that child and make that quick assessment and help guide them on what additional referrals may need to be made.
It sounds like such a comprehensive system. And yes, as you mentioned, continuously evolving and growing as we get resources, realize opportunities, get more information. But it sounds like there's such a great foundation for what you're doing right now and how your department integrates with all of the other departments.
Something else that is really great that we have worked on this year and that has been started in pediatrics is that a behavioral health care professional is located in pediatrics, and after the pediatrician does a screener and identifies needs, the behavioral health provider can step in, talk to the parent and see the child, do additional screeners if they're needed, and they can also make those referrals right away to whatever services they believe that the child may benefit from.
That's amazing to see that there is kind of that flow, because a lot of systems, there are so many gaps for parents. And I, like I said, myself as a parent, but also I talk to parents and caregivers every day who are navigating this journey. And sometimes it's not so clear cut. And it sounds like with the Cherokee Nation, we're trying to build a kind of a roadmap where we're saying, we know that this journey is going to have some twists and turns and be unique to each family and each individual. But here's how it flows naturally forward so that there's constant movement. Would you agree?
Yes, I agree completely.
Perfect. The other thing I think, if you want to touch on at all in the plan, was the, where is it at? Let me see. the community communication. And so we talked about, we had these town halls and all of those things. And I know that we talked about, how we can continue to communicate, whether it's service changes, service additions, or just getting feedback from the community about their needs or their perspectives. And I know that, the system itself does a lot of that through surveys and whatnot. And so I don't know if you wanted to touch on any of that, because communication in our experience was so great, being able to do all of that.
Yes. So the Autism Task Force, it really just opened the door to a lot of families that didn't know who to contact. And so I think having our faces and our names available, it just allowed parents to say, if I need help, I know who to call. And so the town halls were great. We met a lot of families there. And since then, I still get calls, I still get emails from parents and families asking about services and what we can offer and provide. And so now it's really great because I have this task force of other healthcare professionals, nursing, behavioral health, pediatricians, and I can reach out to them and say, this is the need right now. Is there any service available for this? So that framework really just expanded and allowed us to help our patients more and help those families more because we have more people that, have their expertise and have their knowledge in their department. And so our communication just improved overall because now we're all getting together. We're all communicating. If someone emails me or calls with a need, I have 10 people now that I can reach out to and say, what service can we provide this person or what would your department be able to do? And so that continuous communication, it hasn't stopped. The families are, they're all still out there and they all still need help and need services. And we're just able to really all work together as a unit and help identify those needs and where they can go to get some services.
All right. So any goals or areas of focus for the upcoming year or years related to autism services, intellectual and developmental disability services within the Cherokee Nation that you're aware of or working on?
So for rehab services, our big goal for the next year is expansion of services. Right now, we have physical therapy available in the majority of the health centers. And so we're working towards getting occupational therapy and speech therapy out to other areas of the reservation. So that's our big goal, is just expansion of those services. That way families everywhere could go into a clinic and receive any of those therapies that they need. And with that, our providers, they have a goal themselves. They're taking extra courses. Our treatments are based on evidence. And so the evidence is coming out all the time about better treatments, better assessments, better screenings. So our providers really take that initiative to take those extra classes. They're lifelong learners and they love seeing our patients and working with them. So we're finding ways to make our therapy sessions more fun, but also staying up to date on what the most beneficial treatments are. As we are able to expand OT and speech out with PT to all the health centers, that will expand our services to pediatrics, expand all of the patients that have autism, all of their treatment resources, and that's our big goal for the year.
That's a great goal to have. And, for the listeners, Cherokee Nation Health Services is the largest tribally operated healthcare system in the United States. And that is a huge lift, and that is a huge responsibility. So the fact that it's constantly evolving and moving forward, and like you said, hitting those evidence-based principles, constantly bringing on professionals with great experiences, technical knowledge, and then growing and keeping up to date is great. The other thing that's unique is that we are tribal, and most of the folks that work there are tribal as well, and that there is that cultural rooted element to a lot of what we do in terms of how we serve individuals, how we function, the way that we feel and look in terms of our environments. And I just want to say that is, our culture is our medicine in a lot of ways. And so the integration of both is phenomenal. So can you please share with the listeners that a number that they can call if they have concerns, questions, ideas, or just need some services and supports?
Yes, we have a patient experience team who's always available by phone. Their number is 539-234-2273. And they also have an email that they check daily. It's health@cherokee.org.
The other thing I just wanted to touch on really quickly is the number of individuals that we're seeing. And so when you look at our national data related to autism in particular, and we've said this, and I think it's even mentioned in our task force report, that we do not have a good accounting of tribal citizens anywhere with autism, because a lot of times they're not included specifically in the data collection that occurs nationally. And so I know that we put that in our task force report, that we wanted to be better at it in our own systems. Are we getting any senses of data collection looking at diagnostic?
I do know that they have implemented a sensory icon on all of the medical records. So if someone had a sensory need, that would identify the provider, and we can help that patient and work through those identifiable needs. So I know that has been accomplished, and that really helps us know, if a patient is hard of hearing, or whether, eyesight or sensory problems, that flag has been placed, so that can help us better serve our patients.
So, Amber, we talked about a ton of stuff in terms of what your department does, what the whole system at Cherokee Nation Health and the Cherokee Nation system broadly. We're both citizens of the nation, and being able to serve our folks and walk along them and learn what needs they have and kind of integrate that into the work that we do in our respective areas. Is there anything else that you think is important to talk about that we haven't already discussed?
I think if families are listening, I think just to know that you have support at Cherokee Nation, whatever that may be. Talk to your pediatrician, talk to your therapy provider. We're all here to help, and we're all here to guide you and help your family in whatever that may be.
So navigating the total journey for our people and our families and our communities is definitely something that needs to be, reminded. We need to be reminded that this service, this support is available. So listeners, take that phone number she provided, that email she provided. And if you have questions or need some assistance or even support, just contact, and they'll help you navigate and see what it is that they can assist with. And we probably should have said this in the beginning, but Cherokee Nation is a massive nation, not only in terms of number of citizens, but also the footprint that we hold. So thank you, Amber, for joining us today and for sharing your valuable insights. Your contributions to our system are truly remarkable, and you are positively impacting the lives of individuals and families. You're instilling hope, and you're giving promises for health, wellness, and the future. So thank you.
Thank you for having me today. I've really enjoyed it, and always here to help in whatever way that I can.
Okay, so one of my favorite quotes in the process of the Autism Task Force and the subsequent report was from our Principal Chief, Chuck Hoskin Jr. It says, "Still, no matter what challenges and potentials our fellow community members bring, everyone deserves to feel valued, understood, and accepted. As we take this journey together, let's remember to listen, learn, and celebrate the beauty of our differences." Our approach to service structures, which harmonizes innovation with cultural foundations, distinctly differentiates us from others. We regard our people as integral members of our community, valued and nurtured, rather than marginalized or treated in a way that makes them feel inferior. We want them to be seen, and we want them to be heard. This embodies the essence of our identity and will continue to propel us forward in the realms of healing, healthcare, education, and policy. Essentially, in all our endeavors. Previous Principal Chief Wilma Mankiller says, "The most fulfilled people are the ones who get up every morning and stand for something larger than themselves. They are the people who care about others, who will extend a helping hand to someone in need or will speak up about an injustice when they see it. And that is exactly what those of us in the helping profession do, and those of us who are walking journeys of various types do. We say something when we see something. We stand up for ourselves and for those who can't yet stand for themselves. We do not allow injustice to continue and permeate. We change lives, we lift up others, and we instill hope. I want to thank Lucas Frazier and the boys for the use of their drumming music, and I want to thank Cherokee National Treasure Tommy Wildcat of the Cherokee Nation for the use of his flute music. Season 2 of Black Feathers podcast is focused on Oklahoma, spearheaded by the State of the States in Intellectual and Developmental Disabilities and funded by the Developmental Disability Council of Oklahoma. We would love to hear from you. Tell us about your journey with disability and guide us on our future episodes of Black Feathers by visiting blackfeathers.org and answering a short survey. We hope that you will listen, subscribe, and provide rating and reviews. We want to thank our listeners. Please follow us on X, Facebook, and LinkedIn. You can get resources and information about this podcast at blackfeathers.org. Remember, none of us walk alone. Together we are stronger, and it is the roots that bind us.